You start a timer when an SD touch nose is delivered and stop when the learner's finger contacts their nose. What are you recording? A. Inter-response time, IRT. B. Latency. C. Duration. D. Rate. Answer, B. Latency equals time from SD to response onset. Recording every instance of hand flapping during a 30-minute session is what type of measurement? A. Continuous, event, recording. B. Whole interval recording. C. Momentary time sampling. D. Partial interval recording. Answer, A. Each occurrence is tallied. You divide a 10-minute session into 30-second intervals and mark plus if aggression happens at any point in the interval. This produces A. Potential underestimation of behavior. B. Exact count. C. Overestimation of behavior, possible. D. Latency data. Answer, C. Partial interval can overestimate total occurrence. Which metric best standardizes response counts across unequal session lengths? A. Frequency. B. Duration. C. Rate. D. Percentage of intervals. Answer, C. Rate equals responses per unit time. After each aggression, you start a stopwatch until the next aggression, then record that value. What is this? A. Duration. B. IRT. C. Latency. D. Acceleration. Answer, B. Inter-response time equals time between responses. You probe a mastered tact, CAT, once at session start only. This is A. Planned probe data. B. Continuous measurement. C. Partial interval sampling. D. Permanent product. Answer, A. Single opportunity probe of a target. Collecting how long a tantrum lasts from onset to offset measures. A. Rate. B. Latency. C. Duration. D. IRT. Answer, C. Duration equals span of the behavior. If a behavior occurs at a very high rate and you need a practical sampling method, choose A. Event recording. B. Partial interval recording. C. Latency recording. D. Permanent product. Answer, B. Partial interval is feasible for high-rate behaviors. Which graph is most typical for visual analysis of skill acquisition? A. Line graph. B. Bar graph. C. Cumulative record. D. Scatter plot. Answer, A. Standard/most common for continuous session data. You report child complied with 12 of 15 demands. Converting this to a percentage is mainly to A. Increase reliability automatically. B. Allow comparison across differing demand counts. C. Reduce observer drift. D. Turn discontinuous data continuous. Answer, B. Percentage normalizes for total opportunities. Observing a learner freely choose items around the room and timing engagement is A. Free operant preference assessment. B. Reinforcer assessment. C. Paired stimulus preference assessment. D. Multiple stimulus without replacement, MSWO. Answer, A. Free operant equals unrestricted access, measure duration. Presenting 2 items at a time across many trials to rank order preference. A. MSWO. B. Paired stimulus assessment. C. Single stimulus assessment. D. Free operant. Answer, B. 2 at a time equals paired. Giving brief access to an item after a correct response to test if responding increases is A. Preference assessment. B. Structural analysis. C. Reinforcer assessment. D. Scatter plot procedure. Answer, C. Tests functional effect on behavior. A scatter plot primarily helps identify A. Function of behavior. B. Temporal patterns, time of day patterns. C. Treatment fidelity. D. Generalization probes. Answer B. Clusters across time periods. Noting what happens right before problem behavior documents the A. Consequence. B. Response definition. C. Function. D. Antecedent. Answer D. Immediate precursors. ABC continuous recording includes A. Latency and IRT only. B. Only antecedents and consequences, no behaviors. C. Direct observation of antecedent, behavior, consequence sequences. D. Functional analysis manipulation. Answer C. Documenting natural ABC relations continuously. During a functional analysis, conditions are alternated to A. Evoke and verify maintaining variables. B. Teach replacement behaviors only. C. Establish a token economy. D. Measure permanent products. Answer A. Systematic test of functions. Teaching a complex chain starting with the first step until mastery before adding later steps is A. Backward chaining. B. Total task chaining. C. Forward chaining. D. Task analysis. Answer C. Start at step 1 forward. Delivering reinforcement for closer approximations of a target behavior. A. Shaping. B. Chaining. C. Discrete trial. D. Generalization training. Answer A. Successive approximations. SD prompt response reinforcement is a typical sequence in A. Incidental teaching only. B. Natural environment teaching exclusively. C. Discrete trial teaching. D. Free operant responding. Answer C. Structured trial format. Fading physical guidance to a gesture, then to a verbal cue is A. Most to least prompting. B. Prompt dependency. C. Stimulus fading only. D. Reinforcer thinning. Answer A. Start intrusive, fade down. Delivering the SD and waiting a few seconds before prompting to allow an independent response uses A. Graduated guidance strategy. B. Time delay procedure. C. Response cost system. D. Non-contingent prompt. Answer B. Systematic delay to evoke independence. Programming generalization includes A. Teaching only in one setting. B. Reinforcing only prompted responses. C. Using multiple exemplars of stimuli/responses. D. Avoiding natural reinforcement. Answer C. Promotes response across exemplars. Functional communication training, FCT, teaches A. Decreasing all communication. B. Non-contingent reinforcement only. C. Stimulus over selectivity. D. Communication forms that access the maintaining reinforcer. Answer D. Replace problem behavior with functionally equivalent communication. Teaching each step of brushing teeth in every session with graduated guidances. A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer C. Practice entire chain each trial. If a learner always answers only when you model first, the problem is A. Overgeneralization. B. Prompt dependence. C. Stimulus discrimination. D. Response generalization. Answer B. Needs prompt fading. Systematically moving from dense to lean reinforcement schedules after mastery is A. Task analysis. B. Reinforcer satiation. C. Schedule thinning. D. Punishment fading. Answer C. Transition to natural schedules. You add a blue highlight around the correct picture and gradually fade it out as accuracy improves. This is A. Stimulus shaping/fading. B. Errorless teaching. C. Response blocking. D. Behavioral momentum. Answer A. Altering stimulus cues then fading. The best way to promote maintenance of a mastered skill is to A. Stop reinforcing entirely immediately. B. Occasionally probe and reinforce naturally occurring correct responses. C. Increase artificial reinforcement density. D. Add new intrusive prompts. Answer B. Move to intermittent/natural reinforcement. Teaching a man that produces the same reinforcer that maintained tantrums implements. A. Punishment. B. DRL. C. NCR only. D. DRA, for alternative/FCT. Answer D. Differentially reinforce alternative appropriate response. Providing attention to a student every 3 minutes regardless of behavior to reduce attention-maintained whining is A. DRO. B. DRA. C. NCR. D. Punishment. Answer C. Non-contingent reinforcement. Reinforcing absence of property destruction for each 1-minute interval equals A. DRI. B. DRO. C. DRH. D. DRL. Answer B. Reinforce 0 occurrences during interval. Reinforcing incompatible behavior, hands in pockets instead of hitting, is A. DRO. B. NCR. C. DRL. D. DRI. Answer D. Incompatible equals cannot occur with problem behavior. Goal: decrease but not eliminate a behavior, rapid hand raising. Use A. DRL. B. DRO. C. DRI. D. Extinction alone. Answer A. Differential reinforcement of lower rates. Extinction for escape-maintained behavior requires A. Providing longer breaks after behavior. B. Ignoring in all contexts forever. C. Blocking all movement. D. Not allowing escape to terminate the demand while reinforcing compliance. Answer D. Withhold functional reinforcer, escape, reinforce alternative. Burst during extinction refers to A. Permanent decrease. B. Temporary increase/response variability at onset. C. Punishment side effect. D. Reinforcement thinning. Answer B. Extinction burst. Primary risk if caregivers give in during an extinction burst. A. Establishing operation weakens. B. Recovery of spontaneous responding decreases. C. Intermittent reinforcement strengthens the behavior, resistance. D. Behavior automatically maintains. Answer C. Partial reinforcement effect. Blocking head hitting and immediately guiding to a communication card, reinforcing its uses. A. Punishment only. B. DRA with response blocking. C. DRL procedure. D. Fixed time schedule. Answer B. Blocking prevents harm, alternative response reinforced. Which is not a potential side effect of extinction? A. Extinction burst. B. Spontaneous recovery. C. Aggression, temporary. D. Permanent mastery of new skill. Answer D. New skill mastery needs teaching, not side effect. Writing objectively, Klein engaged in 4 instances of biting, teeth contacting skin leaving red mark, is appropriate because it A. Uses measurable, observable description. B. Interprets intent. C. Includes mental states. D. Omits operational details. Answer A. Objective and measurable. If you notice a consistent data trend opposite to treatment goals, you should first A. Promptly communicate data pattern to supervisor, BCBA. B. Stop services. C. Change the program independently. D. Tell parents the plan failed. Answer A. Report, supervisor decides modifications. Session notes should avoid A. Start/end times. B. Observable descriptions. C. Personal opinions about family character. D. Target percentages. Answer C. Subjective/judgmental commentary. Before session you review targets, gather materials, and check prior data. This is A. Task analysis. B. Session readiness/preparation, professional practice. C. Reinforcer assessment. D. Ethical violation. Answer B. Standard preparation. When asked to implement a procedure you have not been trained on, you should A. Attempt anyway. B. Refuse all further tasks. C. Look it up on social media and run it. D. Decline and request training from supervisor. Answer D. Stay within competence, seek supervision. Acceptable dual relationship example. A. Babysitting your client for extra cash. B. Connecting with parent on personal social media. C. None of these. D. Trading gifts on holidays. Answer C. All listed create boundary issues, answer equals none. You suspect neglect based on repeated observations, objective signs. You should A. Wait until absolutely certain. B. Report concern following mandated reporting procedures and agency policy. C. Confront the caregiver aggressively. D. Ignore, it's outside scope. Answer B. Mandated reporting. Parent offers expensive concert tickets, you A. Decline politely citing ethics. B. Accept but tell supervisor later. C. Accept once. D. Sell them for tokens. Answer A. Decline gifts. RBTs may collect data in functional analyses but must A. Design and interpret independently. B. Only assist under supervision of BCBA/qualified professional. C. Refuse involvement always. D. Conduct alone if confident. Answer B. Within supervised role. To stay within scope when uncertain about a novel severe behavior. A. Create a brand new reduction plan yourself. B. Apply physical restraint you saw once in training videos. C. Immediately consult supervising BCBA before intervening beyond current training. D. Ignore behavior and hope it stops. Answer C. Seek supervision. Maintaining client dignity includes A. Discussing progress loudly in a public hallway. B. Using least restrictive effective procedures and protecting confidentiality. C. Displaying raw data sheets with full name in waiting room. D. Posting a video clip, faces visible, for peer feedback on personal social media. Answer B. Privacy plus least restrictive equals dignity.